Hello, this is Dr. Lonnie Herman, and I'm going to share with you today about a chronic inflammatory autoimmune disease known as chronic inflammatory demyelinating peripheral neuropathy, also known as polyneuropathy. And this is a condition similar, not the same, but similar to multiple sclerosis and ALS, also known as Lou Gehrig's disease, where there is a demyelination of the nerve tissue in the body. And a demyelination is when the covering of the nerve seems to disappear. And it's caused by a stressed activity by the immune system, which can remove the covering of the nerve. So let's think of this wire and what's inside this black tubing, so to speak, of the wire. There's, let's say, copper wires inside, and you don't see the copper, so you see this black tubing. Now imagine something is eating away at this black tubing, and when that tubing disappears, the wire is exposed, and in the case like the nervous system, the electrical signal that's running in this wire won't be able to run anymore. So the brain is trying to send the signal down the spinal cord and out the nerve to tell the foot how to move, and the foot won't be able to move because the wire cover, also known as the myelin sheath, which I'll put some of these words at the bottom of the screen here so you get the terminology and you can read them and see them, is that when the myelin, the covering of the nerve, is gone, the nerve can't carry the signal from point A to point B. Now, most physicians out there, especially in the American medical world, are saying that the chronic inflammatory demyelinating syndrome is caused by an autoimmune condition, and the causes of the disease are unknown, or etiology unknown. So we need to understand something different, and that's what I'm here to present to you, is that there is a way to find why would the immune system, your own immune system, turn on your own myelin. Why would it do that? And your immune system is not stupid. Your immune system has been programmed for eons to do a specific job. And that job is to protect you. Your immune system's #1 job on this planet is to protect you from invaders. So what happens when your immune system finds invaders on a tissue? Is it going to leave those invaders? Let's say it finds some parasite in the body. Does it just leave it there? Let's say it finds a bacteria that doesn't belong there, like a strep bacteria. Does it leave it there? Do you want your immune system to just look at the infection in the tissue and leave that infection there? Do you want it to just look at the mold growing in the body, let's say, for instance, and just leave it there? I think all of us are saying, no, we want the immune system to go after those infections. And the same thing happens when there are toxins on the immune system, let's say on the tissues of the body. So if there's mercury, let's say from a dental filling, what you call a silver filling is not silver, expensive silver. They use mercury compounds. Sometimes silver can be part of a mercury compound, but it's generally speaking, it's mercury for most of the material that's in those silver fillings, and that mercury has been found to go onto the thyroid. It's been found to go to the heart. It's been found to go to the kidneys and the liver and the brain and the bone marrow and a number of different tissues. So when the mercury is there, which is a poison to the tissue, would you rather the mercury stay on your thyroid and cause more malfunction, or would you rather your immune system try to remove it? Well, we want the immune system to try to remove it, but there's a problem when it comes to a metal like mercury. The immune system is not able to defeat the mercury. It's like trying to shoot a bullet through bulletproof armor. It can't do the job. Most bullets out there. So what I'm going to share with you in this description of a patient, a very lovely young lady who has been diagnosed with CIDP, chronic inflammatory demyelinating peripheral neuropathy, or polyneuropathy, and her condition, she's noticed it continue to progress and get worse, and there have been some attempts through some medical physicians and even some alternative methods to try to stop this from taking place. And she saw some information from me online, mostly on Facebook, and decided to come over here from where she lives in another state in the United States. And I did some exams on her, and I'm here to present that to you. And these exams that I do, there's a couple of different kinds of exams that I offer, and one of them is to be able to do a dental examination and be able to find which toxins are in the mouth that are connected to tissues of the body. Now for her, there weren't many different findings like root canals and caps and cavitations where there's an infection in the jaw. There weren't a number of different concerns in the mouth, but there was one major concern in her mouth, which was, I believe there were about 6 or maybe 8, if I recall, I'm not looking at her notes for the dental exam, but there are 6 or 8 mercury, also known as silver fillings, also known as amalgam fillings in her mouth. And they've been there for quite some time. And there is a lot of research out there that points to the mercury in the tooth. There's an invisible vapor coming off that mercury that has been recorded using a special kind of screen and camera, where this mercury vapor can go anywhere into any tissue. So even if you've already had your mercury removed from your teeth, you still have residues of mercury left in your teeth, unless somebody is skilled like me to be able to get that residue out of the teeth. You have residues of mercury most likely on your nervous system, in your brain, in your heart, on a heart valve, in the aorta, in a muscle, in the bone marrow, on a nerve, in the myelin, okay? So let's understand, when I did an exam with her, I was able to do a scanning of the body. I didn't develop a protocol at first. I wanted to see, and I wanted her and her husband to know, to become more aware of what's going on in her body that's causing the demyelination. So let's get this. Now the immune system, again, is like soldiers trying to keep invaders out of your hometown. So let's say that there are aliens from outer space coming in, and we have the Army and the Marines and so on out there saying we have the ability to protect and stop those invaders from getting in. So on her myelin sheath, she has food preservatives and food additives. One in particular, MSG, monosodium glutamate, found with my bioresonance testing, a very unique system, without using any kind of electrical equipment. MSG BHT, which is a cancer-causing preservative that's found in a number of different foods, in her myelin sheath. Those are neurotoxic substances. The immune system is attacking those substances. The Lyme bug, also known as Borrelia burgdorferi bacteria, is on the myelin. So not only will that Lyme eat away at the myelin, she has her immune system attacking the Lyme on the myelin. Sometimes it can't tell the difference because there's so much toxic and infection development inside that myelin that it's attacking whatever it can attack to try to get rid of the infection. She's got 2 forms of candida in there. I found a Candida albicans and Candida tropicalis in her myelin sheath. I found multiple pesticides. I found a serious virus in there called herpes zoster. That is one that is the virus that causes shingles, which is a painful condition, because the herpes zoster most often finds a path that it expresses itself along a nerve bundle. So somebody might get shingles around their rib cage because it travels along the nerve. It can also travel in a blood vessel. Well, we found this herpes zoster. I found the herpes zoster on her myelin sheath. I found a heavy metal called lead. I found no other metals on the myelin when it comes to the heavy metals. I found mercury there, but I found none of the other heavy metals, and I've got samples of all of them in my clinic. I found lead there. I found multiple parasitic infections on her myelin. I found a schistosoma infection on her myelin, schistosoma mansoni. I found the Epstein-Barr virus on her myelin sheath, and I found the dental amalgam material on her myelin. So you better believe the immune system's trying to rid these toxins and infections from the myelin, and it can cause a systemic inflammation in addition to a targeted destruction of the tissue, systemic inflammation that can cause damage to other tissues because we have an inflamed immune system response all over the body. I studied her bone marrow, and in her bone marrow, vaccinations, multiple vaccination side effects and residues from those vaccinations in the bone marrow causing inflammation. I found fungus, multiple strains of fungi in her bone marrow. I found multiple antibiotic residues in her bone marrow. Antibiotics are not the safest thing on the planet. You've been told they are by doctors and by the drug companies, but there's a ton of research that shows that these antibiotics can actually cause a number of different harmful developments in the body, especially a leaky gut syndrome, especially excess candida growth, which can spread throughout the blood vessels. And following right underneath the antibiotic residues in the bone marrow, the next layer of findings, candida, two kinds, candida krusei and candida glabrata, in her bone marrow. That's going to make that bone sick. I found X-ray radiation in her bone marrow. I found dental amalgam material in her bone marrow. I found the Lyme Borrelia burgdorferi, the Lyme bacteria in her bone marrow. Now, understand something about your bone marrow, folks. Your bone marrow is the source of the production of your bloodstream. It produces all of your blood cells. It produces your white blood cells. It produces your red blood cells. What happens when the bone marrow is sick? What happens when the bone marrow is loaded with infection and toxin? Whether it's viruses, parasites, mercury, lead, arsenic, cadmium, metal. It's got antibiotic residue stuck in there because it's a sponge and it absorbs things to the bone marrow. What happens when that bone marrow is loaded? Your blood becomes sick. Your blood is not born in a healthy environment, so it can't be healthy itself. It's born with the toxic exposure, infection exposure, and it's going to carry those infections and toxins out of the bone, through the blood vessels, to various tissues, and then back into the bone. So that bone needs to be cleaned, because you cannot have a normal immune response in your body until one of the areas that's important, which is your bone marrow, is cleaned out, because you have to create clean blood. Now, there is research that infection can even be inside the red blood cell. Now, in addition to the bone marrow and the myelin, I did another scan of another system called the portal vein. And in her portal vein, I found mycoplasma, harmful mycoplasma bacteria, and that will be rid in time. I found again the Lyme Borrelia burgdorferi bacterial infection in the portal vein of the liver. The portal vein is a vein that goes into the liver. So we have a blood vessel that carries blood to the liver for the liver to filter the blood, to help hormonal balance in the body, to help us create less inflammation in the body. And guess what happens when the blood vessel is carrying infections and toxins to the liver? Do you think that that blood is going to be clean going into the liver? And do you think that perhaps that the blood has carried some of those infections and toxins inside the liver from the blood vessel that brings the blood to the liver? Is it just possible that the liver is also loaded with fungus and bacteria and parasites too? Even without pain, even without a fever. I'll talk about a fever in a minute. So we've got the mycoplasma, we've got the Borrelia, we've got multiple antibiotic residues in the portal vein, she's got multiple viruses in the portal vein, and she's got multiple mold spores, multiple strains of mold in her portal vein. You know, when a child gets sick, the child can get a fever. So let's say a kid who's 6 months old and is screaming with a fever and red in the face and in pain and just won't sleep and won't let you sleep, the parent. And, you know, you as a parent can get worried about the child, and the child, you try antibiotics and maybe the fever comes down, or maybe it doesn't, and maybe it takes another few weeks or a few days, whatever it is, to get that fever to come down. Maybe you've got to do some alcohol swabs on the body to help cool off the body, or a cold bath or an ice water bathtub to get that child's body to start cooling down, because we can't let the brain get overheated, because death can occur. Let's understand something, is that when a child is 6 months old and has that fever to, let's say, a strep infection or a virus like the influenza virus, you've got an adult who's 50, 60, 70 years old who has carried these infections and toxins over time, which has weakened and stressed the immune system, so it becomes an immune system that can't fight as well as we need it to. And the immune system is working against not only one opponent, it could be working against 150 different opponents at the same time. I don't know about you, but I can't fight 150 people at once and expect to have a good outcome in my favor. So when the body is loaded at her age with with all these different infections and toxins in multiple tissues, she may not have a fever. That fever may not be there because the body's immune system can't do it anymore. A fever is good. A fever is supposed to burn off infection and fight the infection for you. In her capillary beds, capillaries are blood vessels that carry blood and oxygen and nutrients from between arteries and veins, and it's important that this bridge between these blood vessels is clean. Because what would happen if you were driving across a bridge from let's say you're in Hawaii and there's a bridge that goes from one part of one island over to another, and everybody's trying to rush out of one island because there's a terrible storm coming that's going to hit one island, and everybody's got to drive across one bridge that goes over to another island. And there's no storm on that island, and there's no risk of the storm on that island. What's going to happen when that bridge is loaded with cars and there's a ton of traffic? Is anybody going to be able to get from island A to island B at that point? And it's probably, if it's going to be able to happen, it's going to be a long, slow, arduous process. We need to keep the bridge open and clear and allow proper flow to take place. So what happens in the capillaries when there's a lot of infection, which I'll show you, and toxin, which I'm going to describe here, and that capillary is inflamed, that capillary is not able to flow the way it's supposed to help the blood flow and remove a toxin from another tissue. People want to detoxify the liver, but what if the capillaries are all jammed up and you can't get that toxin to flow out? It's just like flushing a toilet and the pipe is clogged, the toilet, all that whatever goes back into the bathroom, sometimes even onto the floor. We've all been there when the toilet won't flush. So in her capillary beds, multiple antibiotic residues in there, multiple vaccinations, X-ray radiation. She's got mycoplasma bacteria, Borrelia burgdorferi, Lyme disease. Lyme is not the only thing, folks. Epstein-Barr virus, Cryptococcus fungus, multiple iatrogenic, also known as xenobiotic chemicals, cancer-causing chemicals, aluminum, heavy metal, lead, dental amalgam, a silver mercury compound I found in her capillaries, and another mercury called dimethylmercury. 3 mercuries, 2 heavy metals, and other environmental stressors in her capillaries. I found in her frontal lobe of her brain. Why did I study the frontal lobe? Because the frontal lobe is a motor controlling part of the brain. I mean, it helps you control the way your legs are going to move. So in addition to a demyelination condition, is it possible that the part of the brain that controls motor in the body, that helps to control motor, because we need parts of the spinal cord and parts of the brainstem to help us do this job, and parts of everything works together in the body. There is no one system that is everything, but let's just understand, the frontal lobe is a major contributor to the motor function of the human being body. In her frontal lobe, herpes zoster, you're going to hear some of the same things, because one infection can be in multiple tissues at the same time and in different amounts, meaning you could have 2 critters of the herpes zoster in this tissue and 10,000 critters of the herpes zoster over there, or call it Lyme, or call it mycoplasma, or call it parasites. You can have 2 over here, 50,000 over there, 3 million over there, 20,000 over here, 15 over here, and 200,000 up there. You can have different amounts of the same infection in different tissues at the exact same time. And you've got to be able to use a specific method that's going to remove those without causing harmful side effects from like drugs can do, or possibly even herbal remedies or formulas that people are using. You've got to be able to use a specific targeted, like a sniper, perfectly targeted method at removing those infections and toxins from a specific tissue that the body will allow. The body has a wisdom. I'm not wiser than your body, but I am wise enough to be able to know how to listen to your body and find, and in her body, as we're talking about, to find in what order are things, in what system first, which organ, and then which infection or toxin in that organ is number 1, which is number 2, which is number 10 to be removed. Is the immune system strong enough to do this? Are the detox organs functioning appropriately? Because I can kill something somewhere, I can help the body kill something somewhere, but then there's no way for that infection or toxin to get out of the body. We got to make sure that those pathways are open. In the frontal lobe, we found herpes zoster, we found Borrelia burgdorferi, I found Stachybotrys mold, I found antibiotic residues. I found mycoplasma, harmful mycoplasma bacteria. I found multiple intracellular parasitic infections and bacterial infections in the frontal lobe. I found arsenic metal, lead metal, mercury amalgam again, parasitic flukes, also known as Herman's flukes. And I found multiple food additives and food preservatives. MSG is a neurotoxin. BHT is a cancer-causing preservative, and it's in one of the most popular childhood rice cereals. Even when it says gluten-free, you can have a poisonous, cancer-causing chemical as a preservative in the food. You got it? Food dyes are cancer-causing and neurotoxic substances. I didn't get to help her treat all of those in the first day. In her first day, I had to go into her body and find what can we do. Now, she came in with already getting in her fat last week, getting some response to the steroids that the doctors are using with her. But she and her husband are well aware of the fact that the steroids won't find and remove the infections and toxins causing the breakdown of her tissue. And for a while, the steroids were having no effect. So she had some relief of her inability to feel centered on the planet, but what we experienced after the first treatment, she came in for 3 days. She came down here to Florida for a 2 to 3 day stint, but I found in the Peyer's patches of her intestinal tissue, these are lymph vessels that help you fight infection and help you remove toxins. These lymph vessels are found in the intestinal tissue. There is a person who discovered these, and the last name of that person was Peyer, P-E-Y-E-R. So these are called the Peyer's patches. You can look it up on Wikipedia if you want, on Google. I found dental mercury amalgam from her teeth in the Peyer's patches. We couldn't treat that yet because we got to fix the teeth first. I found the Lyme Borrelia infection in her Peyer's patches. I found antibiotic residues in the Peyer's patches. I found multiple iatrogenic xenobiotic chemicals in her Peyer's patches. I found parasitic flukes in the Peyer's patches, and I found other kinds of parasitic worms in the Peyer's patches. That's part of her first day protocol. I sent her home with that, or back to the hotel. And the very next day she came in and said, you know, Dr. Herman, and with a smile on her face, she said, I'm feeling something different. Something is definitely already changing in my body. Something I can't pinpoint it, but something I feel more stable. I feel like something is already lifting from my body. Something is changing. I really can tell that. And I said, well, maybe those steroids, maybe. I'm being humble here. I don't know. I'm not God. I don't have a crystal ball. Maybe your steroid therapy is having a more of a change at this point. She said, no. I already know how that's feeling. Something already is feeling different in my body from what you did, because I can tell when it started to change, and I started your protocol. Well, let's get into the next protocol. Now, I don't share every single detail here in these videos because everything is so unique, and there's so much information that I share in these videos on YouTube and on Facebook and in my blog that you've got to understand that and I'm aware and I understand that it can be overwhelming, to say the least. But her next protocol was really important because we found that the body was ready to start going after some infection on the peripheral nerve and in parts of the brain, in the premotor part of the brain, and in the capillary beds. So we found an order of things that we could really get into after we were able to work in one part of intestinal stress, which was in those Peyer's patches. Now, in her very next day in exam, I found, which came up as the main degenerative organ. And this is not simple. This is not where you can just study a course and get into this. You've got to be able to have some wisdom about how the body's functioning, what the person's symptoms are. We've got to know what we're doing with a person, because the body is a very delicate system. The body deserves respect. The body deserves not to be poked at and prodded. The body deserves to be listened to in a certain way. And hey, you might be saying right now, what is he talking about? Because I get the blood test and look at the blood test results. But let me ask you a question. When we talk about a wisdom of the human body, when we talk about a wisdom and energy, physics, that even Albert Einstein, one of the most heralded geniuses in humankind, whether you like him or not, he stated that all matter is energy. And until you understand that it's all about physics and biophysics, these chronic diseases are going to remain on medications for a long time to come, as there is more chronic progressive breakdown of tissues in the body. And something that I want to share with you about studies that was done about energy of the body and the physics of the world around us is that, have you ever felt, and these studies have been done, have you ever felt where you're standing in line somewhere, you're focused on something, you're focused on being the next person at the register or whatever, and all of a sudden you feel like somebody's looking at you, and you turn your head and you look over your shoulder, and there's somebody who's staring at you, and then they look away. Whether you were trying to look at a girl, or a girl's trying to check out a guy, or whatever it is, or you're looking at the way that somebody's handling their children, and they turn around and look at you like, don't bother me, mind your own business. But there is a sense, there's a wisdom that the body has. You can actually feel when somebody's looking in your direction and you turn and you catch them. There's a wisdom that we have, and there are tons of studies that have been done about this. So we've got to listen to the wisdom of the body. Now, in her peripheral nerve, which is her first degenerative organ, dental amalgam was there, but I can't treat it yet. I can't help her remove it, or what you might call chelation. I don't use those chelation toxins. I have a very much more precise way that won't cause aggravation in the tissues. The dental amalgam is on her peripheral nerve. Can't be removed yet because it's in the teeth. Got to get the teeth done first. I found the measles, mumps, and rubella vaccine on the peripheral nerve, causing harmful side effects to the nerve. We found another mercury, a silver mercury compound in the peripheral nerve. This bioresonance testing is expert, folks, and we can find within seconds, without taking biopsies and cutting you up into little centimeter points and sending you off of to all these different laboratories to study what's going on in there. We can know within seconds, with a unique set of eyes and ears, to what's going on in your tissue. Her measles, mumps, and rubella affects the silver mercury compound effect in the peripheral nerve. She had a very high level on the peripheral nerve of MSG. Now, these are all coming up in priority order. MSG, neurotoxic substance, on her peripheral nerve. Multiple parasitic infections at a very high level, and her body's ready to start going after and killing those at a very high level on the peripheral nerve. She's got another kind of mold, and I won't get into this long name, but I can put this at the, it's so long, but I'll put this name of this mold at the bottom of the screen. The initials are TRC, TNS. I'll put this long name at the bottom of the screen and slow down. You can pause the video if you want to watch that and read that and look it up. But the peripheral nerve with that mold, I also found that she needs some specific targeted remedies to help boost the nerve tissue, peripheral nerve function. I found also that her next degenerative organ is the premotor cortex of the brain. The frontal lobe is motor. The premotor, this area needs a nice boost, a nice jump start, so to speak. If you got a dead battery, you can get jumper cables, hook it up to a nice car battery that's functioning, and you can get a boost. Well, I'm not here to maybe in one visit fix her, and I don't know how well she's going to get in one visit, how much improvement, 10%, 20, 80%, I don't know that. But she will get better, that's no doubt. But the premotor cortex needs a boost, it needs some jump start, and it's ready for that. A part of the brain that senses pain and can give us emotions is known as the cingulate gyrus. In the cingulate gyrus, she has more mercury amalgam, she has the Lyme infection, and quite honestly, neither one of those could be treated because the mercury and the Lyme in this case seem to make a strong bond, and it's just, we have to wait for that mercury to come out of her teeth to treat some parts of her condition. She also has a terrible malfunction with her immune system, and there's going to be some specific remedies for that, some lymphatic function to help improve the function of that tissue that helps you fight infection, helps you remove toxins. That's getting a boost in this. And finally, in this visit, we found her capillary beds ready for the removal of the Lyme infection, the Herman fluke infection in the capillaries, and the Candida glabrata in the capillaries. And if you go back, what I said, her capillaries have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 different infections and toxins. And in this visit, she's only able to go after 3. So this is a reminder to her and her husband, as well as anybody else who's watching this, you, with your chronic illness, can't just go over every single infection and toxin all at once. You've got to have a specific understanding of what's going on in your body. You've got to be able to break it down in a certain way. You've got to have a specific, regulated, wise, step-by-step method to remove these infections and toxins from these tissues, and specific steps to help you regain the tissue. So I'm going to share updates with you about this wonderful lady as she goes through care, and I'm here to help you. I'm here to help you if you've got chronic inflammatory demyelinating neuropathy, if you've got any other kind of neuropathy or neurological condition. I've got a very unique set of skills, and I'm one of not too many physicians on the planet who know how to do this kind of work. And I'm here for you. My office is in South Florida. Click on the subscribe button on my YouTube channel. Friend me on my Facebook page. I'll put the address up on the screen here to my Facebook page. Look at the other videos on my YouTube channel. I go over, and when you see me more with my updated ones where I'm in the vest and the tie, these are all my newest videos with more advanced understanding and unique training and clinical skill than what I've had in the past several years. Even though I've had good results before, I need to narrow the margin and get everybody well. So whether it takes a month, a year, 2 years to help you reverse your condition, that's just what it is, and you are you, and you're unique. You got it? So thank you for watching this video. My phone number in my clinic is 954-370-3100, 954-370-3100. I'm here to help you. I look forward to helping you, and let's make a difference in your life. Thank you.